back with another video. Today we'll be recording BBS stall, guys, where we're giving out info, guys, for the BBS blind people charity, guys, where there's booklets and there's info and there's a charity stall where people can buy things. Hi there, we've got Angela here from BBS, guys, and we'll be passing on.
Hi, so we're here with us at Rare Disease Day today on the BBS stall. So we're raising awareness on BBS and the patient group and how we engage with the patients and the clinic. So we're going to go for a walk around all the other stalls and have a look at them as well.
Yeah, we can start with guys. We're on another stall now, guys. We're going to explain to you guys. We're going to explain to us what the stall is we're up right now.
Yes, so Klinefelter syndrome is a genetic condition where it affects boys and men only, where they have an extra sex chromosome.
Yeah.
So instead of being XY, they are XXY. And
What are those terms?
so
Everyone would know that, sorry.
So females have two chromosomes, and I'm not a medical person, but XX make them females.
Okay,
Boys tend to have XY, and people with Klinefelter have an extra X.
And how it affects people, there's huge variability. So some people with the condition have learning difficulties, some don't, some have autism,
ADHD, guys.
So some people don't know they have the condition until they try for a family, and then they find like they're infertile.
Okay, yeah. Any other info you can give us?
So Klinefelter Syndrome Association is a fantastic association that supports people with the condition.
Yeah.
We have an annual activity weekend in April in Derbyshire where you can do canoeing, rock climbing, bouldering, have a fantastic weekend with families and people with the same condition. It's an amazing community.
How do you guys get people there? Do you guys help people get in there travel-wise?
So at the moment people travel
by themselves?
yeah.
Do you guys cover that? How does that work?
We don't cover it. We're a very small charity with limited funds, but the activity weekends is very good value.
People pay for the activities? That's what I'm trying to find out.
Yes, they do. It is, if you're a member of the association, it is about £80 for the weekend.
Okay.
So that's
What happens if you're
Friday.
not a member?
You have to pay more.
What's that price for that?
I can't remember.
Is it over 100?
Yes.
Between 100 and 200, should we say?
I'm not sure. It's a lot more. But you get all your food, all the activities for the weekend. So
And place to stay? Is there a place to stay as well?
yes.
Okay, that's fine, that's nice. Nice to hear. Thank you for your
Lovely to
info.
meet you.
Nice to meet
Happy
you.
to meet you.
Thank you.
Bye.
Bye. Hi guys, we're at the next stall now, guys. What's this stall about, guys? If you can explain
This
it
is
to us.
about epidermolysis bullosa, which we say is hard to say and hell to live with because it's a very painful genetic skin condition that causes blistering and skin loss at the slightest friction. And what we're doing at our stall here with QREB is we're trying to research to find treatments for EB, epidermolysis
What age
bullosa.
does it start at?
Starts at birth. It starts at birth, so it's usually quite obvious at birth if there's a problem.
Okay. Does it get worse when you get older?
It gets worse. It's progressive, and with some young adults, they'll get a malignant skin cancer as they get older, and it's progressively disabling.
Does it affects them like any walking?
It affects walking, it affects eating, it affects sleeping, to be honest, because it's
Sleeping,
very,
wow.
very painful.
Painful.
And it can affect the eye surface.
Is there any medication for this?
Well,
for the
there
treatment?
are now just a few topical creams that are,
Okay.
but we don't have anything that can really do the whole body at the moment, but hopefully soon.
Like any antibiotics they can take?
Do you have to use antibiotics because they can get skin infection?
Yeah, that's what I was wondering.
But
Other than the cream?
we really want some really good whole body gene therapies, and that's what we're working towards.
Working on. Do you know when that will be out, or do you know how
No,
long
we
it will
don't
take?
don't know that yet, but
Okay,
working
so
hard on it.
alright, that's fine. Thank you. Any
you,
other
nice to
info
meet
you guys want to give us?
Sorry?
Any other info you guys want to like include?
Well, I think all of us with all these conditions
Yeah.
have to be working together because
Yeah, yeah. It's all connected.
we're all friends together.
Yeah,
So
no worries. Thank you for your info.
Nice to meet you.
Thank you, nice to meet you. Hi guys, we're on the next stall now guys, another charity. And what stall is this and what your infos are?
So I work for Deborah UK, which is a charity for those with epidermolysis bullosa,
Yeah.
a skin condition.
Yeah,
And I'm here with one of the nurses,
yeah.
the adult EB team.
I'm Charlotte. I'm one of the clinical nurse specialists based here at St Thomas's, and
Yeah.
I look after all of the patients throughout the UK that have got epidermolysis bullosa.
Okay, yeah,
Yeah.
that's nice to know. So what kind of things do you guys do?
So I'm a nurse, so I case manage all of the patients that have got EB.
Okay.
And we run clinics in the hospital, we take our patients to theatre, we go and see patients in their own home. It's a skin condition when they have got very severe
Okay.
wounds.
People that can't move.
So they can move, but they've got wounds.
They've
So
got
any
wounds.
form of friction can cause a
Okay,
wound
yeah.
on their
You do
skin.
home visits.
So we do home visits, we take them to and from theatre, we look after them in clinic, and we basically manage all of their care.
Okay, that's
Yeah.
good to know. Is there any like medications that you need to give them, or any info you can give us about that?
Yeah, so it affects them externally and internally. So the main thing that they need is lots of dressings to protect their skin. So they have a lot of wounds, so we help with the dressings and managing their condition. They take lots of medications, but everybody's different, so everybody will need a different medication for a different thing.
Okay, that's good to know.
Yeah.
Any other info that you can
It's a
give?
very painful, very rare condition, and our patients are incredibly brave and awesome. That would be my one thing.
Do they get this condition from birth, or is it age related?
From birth, yeah,
From birth.
birth, yeah.
Does it get worse when the age starts going, when the age gets older?
It depends what type they have. There's lots of different types, but generally, in some patients it can get a little bit better as they get older, but in a lot of patients it can get a bit worse as they get older. Yeah.
Hi there, we're at the next stall now, guys. What's this stall about? What is it called?
So I'm with Genetic Alliance UK, and we are a umbrella member organisation. So BBS UK is one of our members.
Okay.
And we try and campaign on a national level what people living with rare conditions feel is their priority that we want to put in front of MPs. So we do a lot of research. We also try and get people to come and meet decision makers, or share their thoughts on what they feel is important. So Anunique is one of our members. So we have lots of members here present today.
Okay, that's good to know.
Yeah, and we produced this fantastic infographic that's called focusing on equity.
What is that?
So for Rare Disease Day, we did a survey. We had like over 200 responses, and it was lots of people got involved, like all our many members, and they were saying what equity means to them for Rare Disease Day.
Okay. So what is it actually? Because you use the term no one probably would know or understand.
What equity?
Yes.
It means not recognising. Ooh, you put me on the spot. is recognising equity means something different to everyone. We can't treat.
Where everyone's different.
But we need to do more to make sure that people, where there's inequalities, we need to address those by doing a bit more for some.
Making it more better.
Oh dear. I think we could have done a better one. But you can see on here, it means no treatment is one size fits all. This kind of thing. Lots of people are fed into it.
Do you guys do any treatments or any medication-wise stuff, or is it just mainly public research?
What we do is sometimes, so for BBS, what we did recently is we know that NICE, so who makes decisions about whether to make medicine available in the NHS, they when they're evaluating medicine, we might say, oh, we need to speak to BBS UK, or we need to speak to this organisation, and we try and facilitate that. So we're a bit more of a national,
You guys are more national, getting more info,
signposting,
posting,
sharing opportunities to share your opinion, that kind of thing.
Anything else you want to put across info-wise?
We also organise Rare Disease Day UK campaign. And we also have Syndromes Without a Name, so SWAN UK, so we don't just, not just rare conditions, but some people who are not diagnosed yet as well. And you can go on our website.
Okay, thank you for your info. Thank you.
I hope that was loud enough.
Hi there, we're at the next stall now, guys. What is this stall about and who we're speaking to?
So my name's Dr. Nabil Malham. I'm a paediatric nephrologist at the Evelina Children's Hospital. And this stall is all about nephropathic cystinosis. It's a multi-system disorder for both children and adults. We run a specialist clinic here. It's one of 3 clinics in the country, a specialist hub centre providing multidisciplinary support for children with this condition and adults with this condition as well.
Does this condition come from birth, or does it start going?
Yeah, so it's a condition that is a genetic condition. So and it manifests itself usually in the first year of life. So children often have this condition in the first year of life, and it's a lifelong condition. So they need lifelong support for it.
So, is there any treatment for this?
Yeah, so there's lots of treatments where the treatment is all about trying to help our patients live with a good quality of life. But the treatments, a lot of medications that they need to look after their kidney problems. They also need to take cysteamine, which is a specific treatment for cystinosis to delay the progression of the disease, and that helps.
Is there any medication for that?
Yeah, there's medicine for that, but there's also eye drops they have to take to protect their eyes. So there's a lot of medications they have to take, and ultimately these young people will need a kidney transplant at some point in their life as well.
What age?
So it varies. So decades ago, it always used to be in childhood before cysteamine treatment. What we're seeing now over the years with better treatment is that that's being delayed now until adulthood. So we're having more and more young people needing transplants, not in childhood but in adulthood, which is
That's good to hear. That's good to hear.
Absolutely.
Thank you for your info.
You're welcome. Thank you for joining. Thank you. Bye-bye.
Hi there guys, we're at the next stall now. What is this all about and what do you guys do?
Yep, so I'm Tuti Boiser. I'm the Director for Nursing and Midwifery for the Southeast Genomic Medicine Service Alliance. So we really support all the genetic testing and genomic tests and also the pathways for patients who need genomic tests. So we've got lots of, we deal with education as well, so educating all the nurses and midwives for my part, but also other health professionals like the doctors, pharmacists, everybody. So we've got lots of resources for education for healthcare professionals. We also talk to patients to kind of
see what their preferences are in terms of their care. So we've got some patient stories over there as well that you can have a look at. And we've got lots and lots of networks that you can join, not just for health professionals, but also for the patient. We've got a patient advocacy group as well.
Any treatment? Any medication?
Well, we don't really talk about specific treatments, but because we support the professionals and services. Yes, but also we make sure that they also, in terms of the pathways to genomic healthcare, which includes the treatments, that they'll, we support them in getting those more smooth.
Okay, that's fine. Thank you for your info.
Oh, thanks so much. Yeah.
Nice meeting you.
Nice to meet you.
Hi there guys, we're at the next stall now. What is the stall and what is the info you can give us?
Hello, I'm Dr. Lucy Mackay. I'm the CEO of a charity called Medics for Rare Disease, and I'm sharing a stand with King's Health Partners, who have a rare disease network. Here's Christina.
Hi there, welcome.
Hello. And what Medics for Rare Disease does is we would like to see a world in which there's equitable healthcare for everyone, regardless of how rare your condition is. And so we're shaping a medical profession that can provide timely diagnosis and excellent care to people living with rare conditions. And then groups like the Rare Disease Network of King's Health Partners, they help us do this, and we work in collaboration to make sure that we want all of the NHS to become rare aware.
Is there any treatment or any medication that you guys use?
Yes, it's an important one. It's called love. What we focus on is what we want people to be able to provide, even if there isn't a treatment. Everyone can provide compassionate and informed and dignified care.
What do you mean by signified care?
Dignified.
Yeah.
So I think that's care that makes you, when you receive care and it makes you feel smaller, or it doesn't make you feel good about yourself, and you feel maybe like you haven't been respected or seen as an individual. We want everyone to be seen as an individual, to feel safe, and to feel that they're being truly looked after. Yeah, do you like that?
Yeah, that's good to hear.
Yeah.
Any other info you can give us?
I think if anyone wants to check us out, we've got a podcast and we're on the socials, so find us on Instagram.
What are they?
So at Medics for Rare. Medics for Rare. What's your favourite platform? Do you use social media?
I use YouTube, TikTok, Instagram. I use all of them.
All of them. Okay.
Yeah.
We'll come and
my
find you.
YouTube is on my hat.
Thank you. Is that your name?
Mihir Topal.
Lovely to meet you.
Give the hand, man.
Thank you. Thank you for your info.
Thank you for your time.
Hi there guys, we're at the next store now. What is this store and what can you guys give us info wise?
Yeah, so we look after people with a condition called XP, which is short for xeroderma pigmentosum. And basically people born with this condition can't repair damage from sunlight. So they have to shield completely from sunlight, otherwise they get lots of skin cancers.
Okay.
So here's some of our things that we ask people to wear to shield them from UV. So we have a UV blocking mask here, we call it a visor. And some examples of some fabrics which we ask people to wear that sunlight can't get through them. So they're the best. We ask them to put on lots of sun cream. And here's some of our teddies dressed up as how we would like someone with XP to be.
Okay.
Dressed up like that.
Any medication?
At the moment there's no treatment for XP, but prevention, so wearing all the sun protection that we advise, will stop the people getting as many skin cancers. Okay, so the earlier the diagnose, the better the outcome.
Okay.
Sunscreen as well.
Do they get this from birth? Or?
It's a genetic condition, so you're born with it, you can't catch it. Yeah.
So does it get worse when you get older?
So it can do, it depends how much sun exposure you've had. But as you get older, you can come up with lots of skin cancers if you've had a lot of sun exposure. Yeah.
Okay. That's good to know. Thank you.
That's good. So this is one of our bracelets we've got. So if you wear this outside and it turns blue, you know there's UV present in the environment. So would you like a bracelet to test if there's UV?
Yeah, please.
There you go.
Thank you. Why is it blue? Just wondering.
Well, I don't know why it turns blue. I suppose they could have picked any colour, but that's just.
You know, you said UV protection. Is that the wristband or?
So it doesn't protect you, it just tells you if UV is present. So if it goes blue, UV is present in the environment and you need to protect.
Okay.
So it's just a quick way of telling our patients they need to protect.
Okay.
Yeah.
Nice to meet you.
Nice to meet you too.
Thank you.
Good luck.
Thank you. Hi there, we're at the next stall now, guys. What is this stall about and who we got next for?
Yeah, so my name's Meg and I'm from Amy and Friends. We support children and young people with Cockayne syndrome and trichothiodystrophy.
Okay, what is that? What's the term for that?
So
everyone might know.
Yeah, so they're both rare genetic disorders, DNA repair disorders, affecting the children from their heads down, head to toe.
Okay, what will that affect them, like walking?
Everything, so it's multi-system, so it affects the whole body. So the children will get, if they can talk, they will lose the ability to talk. If they can see, they'll lose the ability to see, as with walking and hearing. If they will get Parkinson's, spina bifida, microcephaly, everything.
Is this from genetics, birth, or is it, can it catch, or?
So it's genetic. So mum and dad are both carriers, and they send the spelling mistake, is how I understand it, down to the child, and it's a 1 in 4 chance whether your child will have.
Okay. Is there any treatment, medication for this?
So it's currently symptom managed. There's currently no cure, if you like, for autism.
How can they manage it if they have it?
So the dietitian will manage their diet and the calorie intake. There's pain management.
Do they go overweight or like
underweight?
Underweight.
Yeah, so the children are underweight all of their lives, which they don't stay on the normal growth charts.
Okay.
So what will happen is that we've made our own growth chart, which is just here, and that the children are on that growth chart now.
On standing.
Yes.
Yeah. All right. Thank you for your info. Nice meeting you.
Nice to meet you too. Thank you so much.
Hi there, guys. So we were at the BBS workshop today, guys, and we've learned so much info for different genetics and different stalls, guys. Don't forget to like, share, subscribe to the channel, and we'll put all the details down below, guys, and information.